After that, we thanks to everyone that are connected. We don't want to waste your time. So we will start to see what you can do using our solution. We will see standard prosthetical project and also one new solution that is the fixed solution. Okay, so another use of our OT Equator. Okay, so together with me there is Dr. Emiliano Ferrari.
Good afternoon.
We are really glad as Ryan 3 is first of all a friend, then is a great dentist, and also is a technician. So he can speak also on the technical side of the lecture, okay, because he has the knowledge about that. We will start today to see what we can do. This is our basic solution, okay? So Ryan 3, who don't know me, I'm the CAO today, but I'm one of the owners since 37 years. So we are one very old company, like Euthanasis, that you were together even when we start, not 37, but 30, okay? So he see together with us the evolution of our company. The basic design is the ball attachment. How you can see, we have a Castable that may have different design, different diameter with a color coded. Then, thanks to the implantology, to the CAD-CAM, we also design different same attachment but for different use. Okay, so you will see that we have the widest range of solution as possible. Okay. We will see that starting from the basic, this is the standard use, the common use, the older use. So I go too fast. We have the Castable sphere, in this case strategy, connected to the wax up. So in this case we can call analogic way to go. So wax up technique and casting in any alloy we want. We of course suggest a hard metal, how almost everyone knows in Greece, because you are one of our oldest area of user. Then we follow the technology, also try to save the cost. So, because the Castable solution, all we know that is an economical way to go. So we can print the crown in plastic, in resin, in Castable resin, and we can bond the Castable attachment and cast. So in this case, we have a mix of CAD-CAM application and Castable solution. In this case, we shut down the cost, but we have one fast and repeatable result, predictable also, okay? Another solution also to try to control the cost of the product, of the prosthesis, using CAD-CAM, so CAD design, in this case ExoCAD, we can design a bar using a plastic disc mill, and only so we can control the thickness, the precision, all digitally, but we can at the end bond the Castable, in this case Equator, to our milled bar in plastic. So we have a milled bar ready to be cast and a castable attachment prefabricated. Okay. Then we have other application growing up following the CAD-CAM solution. We can CAD-CAM the crown, and we can also thread the attachment using one prefabricated component already done from us. So to have a prefabricated component, we will only need to screw in the prefabricated thread the attachment. The yellow color that you saw is a surface treatment to increase the hardness. So the quality is absolutely super, very hard, till 1900 vickers. We have the hex to be screwed. And so we have all the crown milled with CAD-CAM. Going also to the bar solution, we have also the same story. So we don't have, we never forget the past. So we can, it's only about our needs, our technology. We can do a fully wax-up technique using a traditional way to go, or a CAD-CAM solution, or a mix, how you saw before. So we can follow the way we want. In this case, you see, we design a bar, and we design with scanning the existing denture or the wax-up dentures that Dr. Ferrari choose the aesthetic to take a look at the space. You find out in the software the possibility. If you don't find, you can ask to Fluorodental the sum of the file to position and to mill, because in this case, the software and the machine already thread the bar with a 2 millimeter thread. And then you see we have only to screw the attachment you choose, micro, Equator, or 2.5 ball. So you have a wide range of possibility. Going ahead, you see, look, I want, the technician want and choose to use a prefabricated attachment. So you want the best of precision. And what he said, I cast the bar, but I want a prefabricated attachment because the quality of the attachment may compromise the quality, the functionality of the prosthetic project. So in this case, you see, they can wax up the bar, we have a spacer, the spacer leave a hole where you have to bond the threaded sleeve. You can see here a threaded sleeve to be bonded in a distal extension or in a bar, and then screw a prefabricated attachment inside. So this, it's also another way to save cost and to be precise at the end. Last way is I mill a distal extension attachment already threaded, with a hole. The OT Techno, they thread the hole and they bond the sleeve inside with the composite that we have. It's called OT CEM, is a composite made for the attachment, metal to metal, and then you screw the attachment inside. Now, we see that the same attachment you saw for CAD-CAM, for distal extension, for roots, retain, are available also for all the implant brand. So it's enough for you to specify which implant you are using. So we have the Equator, we have the Spheroblock, the ball 1.8, 2.5, we have the Spheroflex that is rotating. So it's up to you to choose the right one to be ready to go using for your prosthetical project. But what is important to know the rules, because the implants, everyone have a direction, and it's very important to try to position the attachment correctly to have a long-lasting retention. So to prevent this kind of wearing of the sphere, because you see this is not a 1 hour product, but is a titanium without any coating. It's not yellow, and if the attachment is not positioned correctly, the attachment may worn out. Okay, so that is important. For that reason, we have solution for high divergence. So we can correct till 50-degree divergence between implants using different options. So for ball attachment, we have directional ring that you can see, gray, red, green, red, that are correcting till 30 degrees between implants. For the Equator, we have a smart box that is correcting till 50 degrees. That is really a lot between implants. Last option is we can customize a individual abutment using Castable USLA and Castable attachment. So you can go over 50-degree divergence. What we do, we offer together with the kit this directional ring that allow you to position the attachment correctly, parallel to the occlusal plane, just rotating the ring. You see here, all the caps are parallel. So in this case, we are safe that the prosthesis is working passively without any stress. What are, Castable, CAD-CAM? Today we are talking about a lot about CAD-CAM, but we never forget that the Castable solution sometimes have advantage compared to the CAD-CAM, because we can customize the thickness much more. So in case here we have no vertical room, we can save a vertical dimension more by the wax than by the software, because the software limits you with a certain thickness. Okay, so wax up sometimes help you to correct correctly the thickness. So this is important to remember where we are, where we come, who we are. Everyone, we need a skill, we need an experience, an history, we need a school from the traditional way to use it correctly with the new technology. So that is very, very important. So don't think that only who is really friendly with the computer may prepare correctly a bar or a frame or a crown just because he knows how to use the software or the computer. You need a skill, you need experience. So only the combination between the two things help you to create a good result. So that is one work patient that come from to Emiliano.
Yeah, this is the starting situation. She's a patient with hopeless teeth in the mandible and questionable teeth on the maxilla. So the treatment plan is to deliver a provisional in the upper jaw and an overdenture on a bar in the mandible. The first things is to increase the vertical dimension, because we need more space respect the starting situation. And that's why we set up the articulator with the increased vertical dimension. On this articulator, we prepare the first temporary and we deliver it to the patients. And now we start with the rehabilitation of the lower jaw. That's the focus of this treatment plan. First things, we prepare a walks-up, a pre-extraction walks-up with the increased vertical dimension, and we deliver it to the patients, extracting the tooth. After the position of the implant, we go for the realization of our bar. And Gianni can tell us how.
Yes, here, for example, we can use a base, a resin base that you can use like a bite registration together with the transfer or abutment to give a perfect position and stabilization in the master model, to take the bite registration correctly and to be transferred to the master model, to be safe that the master model is absolutely precise. We made a control key in the lab and we made in 4-piece to send to Emiliano to control and to connect each other to be safe. And that the master model, it's exactly the situation how it is in the mouth of the patient. So we can make the second temporary using the CAD design with the software, with ExoCAD. So after that, we control, we try to simulate what can be the second temporary. Is working. Okay. And now here we have the second, we do the wax up of the second temporary using the same bus plate of the bite registration, but we set up the teeth correctly with the second temporary on the upper jaw. And what is very important is to control and to take care of the cantilever, because sometimes we may have implants positioned in a very anterior area, but so we have to follow some rules. In this case is a study of McAlarney that is gives some rules about the maximum cantilevers possible, that in this case is, for example, the anterior posterior spread between a parallel line to the anterior implant to the more distal implant. This distance can be made 1.5 in the lower jaw and only duplicate 1 in the upper jaw due to the bone that are different. Okay, so following these rules, we are going to design a bar more stable as possible, you know, because if we stay really anterior, maybe the stability is not the best. So we have scanned the bar, the denture, to take a look at the space. We designed the possible cantilever to give more stability to the denture, to the removable denture. Now we can, you know, control using the wax up of the teeth. First of all, the path of insertion. Using our articulator is one small articulator that is, we can say, is a multi-use. So we control the occlusal plane and we can position using, following this occlusal plane, we have to position correctly the attachment to have a passive and vertical insertion. And this means long-lasting retention and good distribution of the forces. So we, in this case, we follow a traditional castable way to go. So we use a castable USLA, light curing resin. We check the design by using a traditional silicone index, lingually and vestibular. So now we mill the bar in a light curing material, and we have only to position following the directions that we choose with the occlusal plane of the teeth. We choose which attachment we have to position, of course, taking care of the space that we have. So the technician have used 3 attachments in anterior, and to extend without overload the bar, we have one attachment that is called unilateral, that is born to be used only on one side, but can also be used, I'm going too fast, but can also be used distally of the bar. So in this case, you position 2 attachments in the distal, and you can control the resiliency using a softer or harder caps. Now we finish the wax up, we cast, we check the precision on the key, on the model key. You see that everything fit perfectly. This means that fit perfectly also on the master model. So we have to polish the bar correctly to really take care about the hygiene, to make the patient clean the bar easily underneath the papilla. And we have to take care not to worn out too much the sphere. Okay. So after that everything is polished, we are able to prepare using a prefabricated component, so no duplication needed. We have the castable housing of the retentive cap. So we made this frame without any software, by only our skill, wax up, light curing, screwing directly, no duplication needed, cast, and now we use a spray on the bar, how you can see here, to check if the frame is passive or no over the primary bar. So you can see here, we have you can see the equator that are all homogeneous. So it means that the cap are working correctly, homogeneously, and this means long-lasting retention. Okay, so you can see here, to use a draw, that are very important to have this line on the maximum equator of the sphere. That means passive and perfect position working of the retentive cap. I have to clean it. So this is the final bar, final denture that is ready to be sent to Emiliano. It's removable, but if you have a good skill, you can create a very nice aesthetic result, great stability like a fixed solution, but very easy way to remove and clean. And this is how it looks like in the mouth. Okay, so that is, my opinion, one good aesthetical result. Made it in a very easy way, traditional, not CAD-CAM needed. So, my opinion, we have to be satisfied, we save cost, but we are not going to compromise aesthetic. Now, this is another case looking for example, an anterior group of teeth, make a preparation of the anterior teeth. We are setting up the articulator. This, for me, it's something that I was in touch in this week to Catherine. I hope that Catherine is connected, or you can see later on, because was looking forward to see how it works, this attachment. After that, we have the impression, we do the model, and we are now scanning in the lab the model, scanning the old prosthesis to have the relation between upper and lower jaw. We setting up the model using the articulator, the virtual articulator, in ExoCAD. And now, so we are ready to go ahead and to design this bridge. So we design the crown with the software, and we are using the OT Techno as a distal extension because to mill the sphere is really a little bit complicated. Also, to do a laser melting of the sphere is not so easy. You need one super high-tech laser melting machine because the surface usually is really rough. So a rough surface do not allow a good functionality. So who want an easy way to go and a very nice result, you can mill the OT Techno, that is a distal extension with this hole, where you have to bond this threaded sleeve and screw the attachment. You can see here. So we mill the bridge, bond the threaded sleeve in the hole with the OT SEM, and screw the attachment in place. We are also milling a plastic bridge to let Emiliano control the aesthetic, the support, lip support, and how can be approximately the final result. Send the mill bridge to Emiliano. He will check precision, the fitting, that everything works. I speak on your side because there's only one slide, Emiliano.
Yeah, for sure.
So he controls exactly the lip support, the aesthetic, that everything is correct. Also using the plastic mill of the crown, correct?
Yes.
So, and now we are ready to do the porcelain, to polish, and we have this bridge ready to go. So, no risk of bad precision on the attachment area. So, perfect attachment with a nitrate coating treatment, distal extension, guarantee of the functionality, interchangeable choice of the attachment in case you need. And now we are ready to create a frame. I like to show that because we will go step by step to the full digital solution. Here we also have a compromise, half digital, half analogic, half digital, or mixed. So in this case, we have a mill bridge, but we create a frame by the duplication using our component. Positioner, the position on the sphere, duplication investment, monobox, walks up, and then we have the frame casted, control of the passivation, control that everything fit correctly, option of the cap to go in, because to use this prefabricated component are very important because are already calibrated from us to leave a little gap for the cap to have elasticity. So it means nice functionality, no squeezing of the plastic. So that helps you to have a very nice functionality of the frame. Very important when we use this attachment is to design this occlusal space, occlusal stop, because the more the vertical forces are going closer to the axis of the teeth. That is very important. And the attachment is only to retain the frame. So this stop is very important. We can see here a little video that show you how it works, the attachment. You see the stop, it's closer to the crown, but help you to have resiliency on the distal. Okay, so very important. you choose the resiliency, and the fulcrum is closer to the teeth. So no too much overload on the distal during the masticatory forces. Also here, we control with the sprite that everything is correct. You see, caps are working perfectly on the equator. So everything is in position. And now we have used for all this process the black retentive cap. So it's just for laboratory use. It's very economical. You have only at the end of the work, remove, throw away, and insert the new one. So frame in position, walks up, finishing, and the work is done. So very easy. Here we have a mix-up of mill and traditional, so CAD-CAM and cast. So what always I will repeat often today, all our solutions that you will see today can be done using fully digital solution or fully analogic. So it's only a question of what do you want to do or what you are more friendly to do. Now, let's start to see what is important, what is our new solution. It's not really new now, the Equator, because it's in the market since 6 or 7 years, but we have launched another use of this Equator for fixed solution. So you can see that the ball is our older design. We use the Equator to shut down the height. So we save a lot of vertical design, 2.1 millimeter compared to 3.3. So much aesthetic on at the end. We have a video that shows you how it works, because what is important, that the retentive area of the Equator is the same retentive area of the traditional ball attachment. Because someone are scared, oh, it's too small, maybe it's not enough retentive, but you can see that when the caps are going to snap over the Equator, we keep the same retentive area like the sphere, because we only remove what is over the Equator. So guarantee of retention is the same. Then you have different color for different retention. So you choose from 2.5 kilograms, so you can see that you may have a very big retention, to the clear pink. So you can control the retention as you like it. Okay. What is important of this that you can is available for all the implant in the market, any brand, any height, and any diameter. You see that is the smallest attachment in the market, and inside there is a square to be screwed, but also a thread to be used to retain, transfer, bars, or bridge. So this thread is very important, and it's our patent. Okay, it's very important to make a comparison, because there are some competitors in the market. The more famous competitor is the Locator or RTX. So who is familiar with Locator can see that there is a big difference. You can see the head is 3.85, the male, and the Equator is 2.5, so it's more than a millimeter smaller, and this is very important. But also it's important that together, assembled with the metal housing, Locator is 5.5 and Equator is 4.4, so more than 1 millimeter narrower, and that is very important to have at the end one aesthetical result. So we will see that we have a different use of the Equator. It's one design that can be done for root post to be cemented in the root channel, Castable for roots cap, for bar on implants, on roots, implant abutment for fixed solution, for removable, for divergent solution. So you have different way to go. This is me that I'm carrying the Equator everywhere. It's a present of Emiliano for my birthday. You can see that we will see after now some prosthetical case using the Equator solution. We start with the overdenture on roots, then we go to single overdenture on implants, so single retain, CAD-CAM bar or cast bar retained by the Equator. Then we can show you bridge solution, so immediate loading using guided surgery. So, and finally, we can even do small bridge or complete bridge even over unknown implants. So the Equator system is one very big and have a very wide range of use. Okay. So this is, we start with the first case. Finally, it's a clinical solution. So Dr. Emiliano will explain you step by step what he's doing using this case. You can see before I leave that inside every Equator, you will have always a thread that can be used. So Emiliano, you can go ahead, please. Thank you.
This is the first and most simple use of the Equator. It's a common case that you can face in your daily practice. She's a patient with a lot of hopeless teeth, but with some root that we can maintain, because we check the root supports and we understand that we can maintain some root. So what can we use those pivot? We just prepare the provisional, one pre-extractive provisional, and we prepare our root. Having root treatment and preparation of the root with dedicated burns to cement our pivot. This is the final situation after the cementation of the pivot. As you can appreciate, clean situation and very easy to use, very fast to use. And in this appointment, we can deliver our prosthesis. When you use a pivot directly cemented on root, you have to manage often divergence between root, because you can choose the direction of the root as you can choose the direction of the implant. So in this case, it's very, very interesting, the use of the smart box. Smart box, as you can see in the video, is devices, tilted devices that permit the insertion of your denture, also in case of divergence of the implant, or in this case, in divergence of the root. Okay. If Gianni wanna told us how it worked.
Yes, at the end, are only two metal housing connected together. There is the fulcrum, you can see here, of the rotation. And this, in this case, is used on the roots, but can be used in all the implant solution when you have divergence and you want a passive insertion. It's what is very important, that the metal house, the smart box, is different, but is using always the same retentive cap, the same retentive of the Equator cap. So you don't have to change any solution. You change only the metal housing, okay?
In my opinion, the use of a smart box is very comfortable for the patients, not only for the correction of divergency, but also because give really more easy way to use those kind of denture to the patient. Okay? So this first clinical case is something that you can face very frequently in your daily practice because it's an easy way to maintain some root and to have retention in case in which you don't wanna or you can't put some implant. So you can maintain those root for some years or maybe for all the life of our treatment plan. And this is the final situation with the root supports that we can maintain using those kind of pivot. Something really similar we can do using implant. So in some case, when maybe you can't maintain your root or where you can put your implant, you can use those kind of attachment on the same way. This is a case, the second clinical case. It's a case of a patient with hopeless teeth, all hopeless teeth in the mandible and in maxilla. But during the preparation of the treatment plan, we check the root support and we think that we can maintain 2 roots just for the temporary treatment plan. So we choose to use 2 roots on the same way that you saw in the case before. We cement to pivot directly on those maintained roots. And this can help us for the retention of the provisional and to give less discomfort to the patient during the healing of the implant. So we deliver the provisional using those roots to have retention. And now here we start with the surgery for the positioning of the implant in the upper jaw and in the lower jaw in the same day, in the same surgery. So in the upper jaw, we just have to wait 3 months for the healing, just using a denture on tissue support. But in the mandible, we can use our implant and maintain our root, I repeat, to give retention and to give relief to the patient with the discomfort of the provisional that it's on the tissue during the chewing. We wait something like 3 months for the healing of the implant in the upper jaw, and we go with the second surgery for the uncovering of the implant. And at this time, during the second surgery, we directly use those kind of attachment as healing screw. So one of the secrets of those attachments is that you can use it in a lot of ways. And the first way I like to use it is like healing screw. Because during the second surgery, if I can find easy the position of the implant, I can do little flap and screw those attachments directly on the head of the implant. So in that way, we can use it for the stabilization of the provisional, and we can go easy in the realization of the second denture, so the final realization. Very, very important when we use those kind of free attachments, so not connected in a bar, so direct retention from this attachment is very, very important to build a metal frame. So different way to build this metal frame. You can do that on CAD-CAM, or you can easily do that in a castable way, like we have done on this case. So there's a lot of prefabricated components to easy design those kind of frame, and after that you can cast very easy, very fast, very economical, very, very important. Okay, because the use of those attachments for direct retention can give you a point of broken for the denture. So it's very, very important to project and to build a metal frame inside the final restoration. This is the finishing of the denture, upper and lower jaw, and this is the delivery to the patient. So clinical case a little bit different respect the first one, because in this case we have enough bone, enough money to put the implant, and we can do that in the upper and in the lower jaw. But as I showed you before, we can use the pivot for a temporary use, so to give relief to the patient during the treatment. Okay. After that, another use of those attachment for the removable rehabilitation is overdenture bar support. So the meaning of this treatment plane is to use those attachments not only for the realization of the bar, but also for to give more retention during the treatment. Okay. There's a kind of bar that you can screw on those attachments, and this bar is called OT bar. The characteristic of this bar is that it's very easy to be constructed and give you more passivity respect all the other kind of bar that you can do. So this is a case in which we choose removable treatment because of the needing of lip support of our patients. Okay. So we want to give a restoration with the performance of a fixed prosthesis, but we prefer a removable denture because we need something that helps the patient in the support of the lips. So in this case, for sure, in the upper jaw, we prefer to go in the direction of removable denture. In this case, the patient had an old denture that did not enough lip support. So we maintain those old denture during the temporary treatment. This is the positioning of the implant. So very anterior zone. We choose to not go with augmentation surgery, just using native bone to positioning our implant. So as you can see, not very distal position of the distal implant. And this is another reason to don't go in the direction of fixed rehabilitation, because we need very long cantilever. And Gianni, some slides ago, told you that you can use cantilever, but not as you want. You have a rule that you have to follow in the dimension of this cantilever. So in some case, when to build a fixed rehabilitation, you need very long cantilever. Maybe it's better to think a removable rehabilitation. Okay? So, like I showed you before, after 3 months, after the healing of the implant, we use those attachments as healing screw. And in the same appointment, we use those attachments to give retention to our provisional, to remove the palatal zone of the denture and to give something really more stable to the patients. And from here, we start with the realization of the final rehabilitation without unscrewing those abutments. Those abutments are never unscrewed. So we use it as healing screw, we use it for the retention of the temporary, and we use it to screw the final bar, always without unscrewing. And we can do that because there's a lot of components that are dedicated to those attachments. And the first component are screw transfer. There's a lot of transfer dedicated to this abutment. So you can choose the kind of impression that you prefer, with screw transfer or with repositioning. So as you prefer.
So many designs.
Yeah. So many design of transfer. In this case, we choose the screw transfer that, of course, you have to use with a customized impression tray. And after the realization of the master model, the first things that we do is to build an acrylic contour key in laboratory. And then I check this acrylic contour key in the mouth. If during the check in the mouth of this acrylic contour key, we have those kind of precision, we are sure that the impression is a very good impression. So we are sure that in the master model we have the perfect position of our implant. This is what we want, like precision of our acrylic contour. And in the same appointment, we go trying the tooth assembly. So we do all the phonetic trying, aesthetic trying, spacing trying. And when we are happy about that, when we are happy about the aesthetic of our waxing test, we have all the information to go directly to the final restoration. So we have the acrylic contour key that give us the sure of precision impression, so the position of the implant, and we have the waxing test that give us all the prosthetical space. So we know that this is all our prosthetical space inside which we have to put everything that we need for the bar realization. And here start the realization that in this case is done all by CAD-CAM.
Yeah, for that reason, after that, Emiliano have give us all the information, so we know how to have to be the final result. So using in this case, we will go digitally. For that reason, we have scan the existing wax up, we have scanned the master model, so we have the space that we need. We have also, let's see, who is working, okay. So we will position the scan abutment over each implant. So every scan abutment are dedicated because contain all the information, because in this case we choose to create a mill bar using the libraries that we have. If you don't have the library for the Seeger, because we have one specific technique to create a passive bar that always fit, that don't give us problem, and in case you don't have the library, will be done together with our scan abutment. You can be in touch with Thanasi's Flores Dental to have that together with the scan abutment. So after that, we have all the information. So we control the occlusal plane, we check the space that we have to position correctly the attachment, to control the thickness of the bar, to have a strong bars, and decide the position to have a uniform position, good stability. And so now we are ready to mill this bar. Okay, so we have positioned also two strategy in the distal. For that reason, you need a special high-tech machine, but it's not necessary to position the attachment here. It's enough only occlusal to guarantee the stability. In this case, they want to upgrade. And after that, with the software, you can also create a secondary bar. In this case, we choose to create secondary bar using a laser melting technique. So we design a laser melting technique, and we leave the room to bond the metal housing in position with the composite. So we have primary and secondary bar all made in a digital way. So you can see here mill bar and laser melting secondary bar. The bar are already threaded, and you see what we are talking about. Passive connection, because over the equator, the screw have a peak ring. You can see here a peak ring that is cut on a side. You can see here is cut on a side, and this is a hole that goes exactly passively over the equator on the master model. Here there is also a video that shows you how it works. You see the bar play without the peak ring, and you insert the peak ring to stabilize the bar. The bar will click, and the titanium screw will lock complete the bar easy. If you have because always you have the equator head. Always the equator head. Doesn't matter which implant you are using. The head, the platform is always the equator. Okay, so no X, no internal X, no octagon, no trilobe. So always the bar fit. If you, of course, you're not doing one very big mistake, but you can see here, there is a bigger gap than here. This means that with 1X, the bar doesn't fit. Using our system, yes. Okay, so that is one big advantage of the system. So we can go ahead, we will polish the bar really maniacally, because the bar have to be easy cleaned from the patient. So we need to guarantee a very nice hygiene around the implant. The OT Equator is not only on the implant, but you see here is on CAD-CAM. And now we can go ahead with, to finalize the denture. From here, the technique is the same. So this is the screw that goes into the peak, and we can just send the work to Dr. Emiliano, that will try the bar in the mouth. So after that everything works, everything is passive, we control the static, lip support, how was all the parameters that he was looking on the wax up. Everything have to match how the doctor and the patient decide to have as a final result. So everything is done in a very easy way. You can just work in the lab to try to personalize a little bit the color, the design, the ridge, but they use a commercial teeth. So you may have a removable denture. That removable sometimes means poor economical and not really high aesthetical, but in this case, I'm sure that the patient is very, very happy and satisfied about that.
So 3 different ways to use those kind of attachment for removable. Also, if I agree with Gianni that told us that the last clinical case for me is something really similar to a fixed rehabilitation, because those kind of rehabilitation have the same performance of a Toronto bridge with the hygienic advantages and with some aesthetical advantages. So I think that this is a really fixed kind of rehabilitation, but stay in the family of the removable. When we talk about fixed rehabilitation, we talk about OT bridge. That is the new way of using those kind of attachment that Gianni told us.
Emiliano, just back. This is important, to who knows already our solution. From here, there is really something new that help you to use a removable attachment, how it was like today, to be used in a simple way as a attachment to retain a fixed bridge, all on 4, all on 6. So you can do all the kind of rehabilitation. Sorry, Emiliano, just to...
No problem, no problem. Okay, what's the meaning of this OT bridge? You know that the mistake when you want to construct a fixed screwed rehabilitation of implant usually is the divergence between implants. And if you use internal connection and the divergence is over 20-25 implant, it's really difficult to have perfect seal all around the implant platform. So what you have to do, you have to use multi-unit abutment. If you are able to build some Toronto bridge or something like that, you know that you can do this only using the multi-unit abutment. Those kind of abutment have two different functions. The first of all is the displacement of the prosthetic connection outside the gum to relieve the patient from the pain and to be more easy to use from the clinical. But the very important reason for use the multi-unit abutment is the correction of this parallelism. So the meaning is to have the same platform connection outside the gum in all kind of implant. But to do that, you have to use two different kind of multi-unit abutment, straight one or angulated one. Straight multi-unit abutment, the one on the right in the picture, are very easy to use because they are one piece abutment directly screwed on the head of the implant. The angulated multi-unit abutment, so the one on the left of the picture, are a little bit difficult to use because you have to choose the angulation. You have from 15, 17, 30, 35 degree. It depends on the brand of the implant. And they are two-piece abutment because you have the master piece and you have a secondary screw to connect the abutment on the head of the implant. So the idea is to use always one piece multi-unit abutment, so straight multi-unit abutment. And that's what we can do using the Equator. But how can we do that? We can do that changing the shape of the secondary abutment, so the abutment that you have to couple with the Equator, the one that stay inside the rehabilitation. The secret is those wider area that you have on the platform of the secondary abutment that is signed in red and blue here. So those wider area allow you to insert those kind of abutment also when you have some divergence, as you can see in the picture. So we will show you some pictures, some video, some clinical case to explain this concept, but the secret is all here. So this wider area that allow you to insert your rehabilitation, follow the insertion eggs that you have choose. Also, if you have some implant divergent, respect this insertion area. But how can you use? How can it function? It works because we use an elastic seeger, that it's a plastic ring that compensates the space between the first and the second abutment, between the Equator and the extra grade abutment. So we need those elastic seeger to compensate, to fix the two abutments, each other, and we use it as a fixed ring to connect also without the using of the screw. Okay, but we talk about that a little bit later. This seeger is something that that doesn't come from Ray 83, doesn't come from dental world. It's something that it's wide used in mechanic, and is an incomplete circumferent elastic steel, in this case, steel stop ring, used in mechanics as a fixing element, and those is due to its ability to deform itself in a state of tension. It means that because of its ability, it can fix two elements, just compensate the tolerance that you give between one and the other. Okay, so in mechanics, it's a steel stop ring. In this case, is a plastic ring. But why you have to use, or why you have to try to use this kind of abutment if all implant brand have his specific multi-unit abutment? Because we think that there's some benefits, some advantages, and those advantages are mechanical, biological, aesthetical, and specifically in the organization of the daily practice. What are the mechanical advantages, mechanical benefit using the Equator and not using multi-unit abutment. First of all, the screw diameter, that it's bigger in the Equator on a 30%. So you know that bigger diameter means stronger screw. And stronger screw means less fracture of that. And the second reason is the absence of the secondary screw. So the absence of this partial fillet and thin rings that you need to give the space for screwing the secondary screw. So if you use a one-piece abutment, so just like a straight multi-unit abutment, you don't have those kind of problem, and this is a very big advantages in terms of mechanical. The second advantages is the one that I told you before, so the use of the extra grade for the insertion, also in case of important divergence. The biological advantages are related with the use of those abutment in a strategy that it's called one abutment at one time concept. It means that you know that all the abutment manipulation give you a soft tissue downgrowing and a bone loss in time. And this is due because when something heals, when you screw something on your implant and you have the healing of the tissue, we have the forming of a junctional epithelium that it's sealing for the passing of the bacteria and the damaging of the implant. But this junctional epithelium is violated every time that you unscrew your abutment. And after 2 or 3 violations, you don't have it anymore. So the big advantages is to screw something on the head of your implant, to screw the Equator on the head of your implant, and never unscrew it. To don't have the violation of the junctional epithelium. The secondary biological advantages is that the screw thread is not in communication with the internal part of the implant because this is a one-piece abutment. So you don't need the secondary screw that is in communication, and of course is a door for the bacteria to go in the direction of the implant, to give inflammation and to give soft tissue downgrowth, and with time the losing of the bone. You have to use those abutments like a healing screw, and on that way you use it or in the first surgery or during the secondary surgery, and you never unscrew it. But if you don't want to load at the first time, if you don't want immediate load those attachments, you can screw it and use some healing cap like those that you have to screw on the head of the Equator.
Specific for the Equator.
Specific for the Equator with a screw that coupled with the Equator. And in this case, you can maintain your biological seal in the apical part of the Equator, but you can separate the working part of the Equator from the tissue. So when at the end of the healing, you unscrew those device, you just have your portion of functional, the functional parts of the Equator, and you maintain the sealing, the biological sealing in the apical parts. Other and very important advantages are the aesthetical advantages. First of all, because of the low height of those abutments. Those abutment is available for all implant bred, internal connection or external connection. In case of internal connection, it's available also in 0.5 millimeter, that it's really nothing. You have the attachment directly on the head of the implant. And if you have used some multi-unit abutment, you know that the 30 or 35 degree angulated multi-unit abutment is high 4 millimeter. The lower is 4 millimeter. So as you can understand, if you have some divergent implant in the aesthetic zone, maybe because of the direction of the bone, and you have to use angulated multi-unit abutment, you have a 4 millimeter portion of metal that if you don't have enough gum will be showed by the patients. So very, very interesting, the opportunity to use those kind of abutment that you can live in the deep of the gum because of this low height. And another reason, another aesthetical reason, is because you can use it also without the screw, so in a blind way. Okay, and Gianni can told us this video, something about this video.
For example, yes, one advantage is that if you remember that there are the Seeger ring that is retaining really a lot the abutment in place. For that reason, in case we have no room, for example, here there is one standard solution. We have 4 implants. No one implant is giving us a aesthetical problem, so we choose to use all 4 screw and Seeger with no problem. Okay. But in case, for example, we have one implant that you see is giving us problem, we use only 3 screw, and here we are using only the Seeger plastic very hard to retain in position the bridge, and we are not going to have any aesthetical problem on the whole. We cover perfectly, and you see it's enough to have a good area of stability, including this that is not like a screw but really similar. So in this case we save 1 screw using the same abutment. Some examples that can be thousands of examples. We have 5 implants, 2 are giving us problem. We use 3 implants and we use 2 Seeger, only the plastic ring that are not removable but retained, to have a very good stability and not aesthetical problem. So basically is 25% of the aiuto, okay, 25% of the implants can be saved. So if I have 4, I can use a 3 screw. If I have 5, I can use a 3. If we have one area of stability to retain correctly all the bridge. This is very helpful and very important to give us one nice way and one good aesthetic, and no trouble to have one hole in the middle of the crown, and also one big MUA that give us aesthetical problem if the patient smile open, you know, in the upper jaw mostly. So it's up to you. Try to manage, and you can use Seeger and screw or just Seeger and screw. It's your choice, but of course the screw have to be positioned to have a stability, to stabilize correctly the bridge. And this is one big advantage that all the customers are loving, you know, because everyone we know that they all give us problem if he's in a bad position. In case we have, for example, just angulated abutment, we have the chance to have one 15-degree abutment to be bonded, so we can move the screw lingually. So we try to save, if we can, the aesthetic, so we can have a lingual hole not in the middle of the tooth. So what you saw before was a little bit more extreme. To go with the angulated abutment, you need, of course, the angulated screw and the angulated screwdriver that is rotating till 25 millimeter. Okay, so you can use the 15-degree, but you can angulate more the hole to screw to have one good aesthetical result at the end. Okay, so that is very important to know. You see, in this case, you can screw, angulate, you give aesthetic to the teeth, and no problem of the hole in the middle of the teeth. So good aesthetical result at the end.
So I think that very, very important, those kind of benefit for the aesthetic, because are really particular. So the fact that you can use it in a blind way can avoid you to have the problem of the emergency of an implant in aesthetic zone. And it's a very, very important thing, because you can use it. You can use the implant with the Seagull retention without the screw. So you have the function of those implants without the aesthetical mistake of the position. And the last benefit that we think this kind of attachment have are the one related with the organization of your daily practice. Because you have a single connection for fixed and removable denture. And this is a very important advantage. Maybe sometimes in those treatment plane in which you have maybe removable denture for temporary and fixed rehabilitation for final. In those cases, you have the same connection that you have to screw during the healing of the implant, and you don't have to remove. And of course, you have the same component for each implant platform. It means that if you have a fixed rehabilitation with different implant brand, you then have to find different multi-unit abutment, different screwer, different component, prosthetical component. You just have to use those kind of the Equator, customized for the implant brand, for the different implant brand that you have in each clinical case. And after that, you have the same components. So same transfer, same analog, same abutment, everything after the using of the Equator, from the head of the Equator to the final rehabilitation is always the same component. And finally, those Equator are available also for unknown implant. And this is very, 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 very important things. And we will show you clinical cases, really easy clinical cases, to show you the potentiality of those kind of solution. So one very important thing is to choose the correct diameter of the abutment that you have to screw. It depends on the diameter of your implant, but on the website of Rain 83, you can easily choose it, just matching the kind of implant, the brand of implant and the diameter, and you can easy to understand what kind of abutment is correct to use in this case. Okay, Gianni?
Yes, absolutely. It's, because there are only 3 diameter, because of course every implant have a narrow platform, regular, wide. So the only thing that is changing is the diameter of the Equator platform, and you need to choose the right titanium abutment that are not going to over contour the platform. So if it's a 3.5, you choose the 3.5, of course. If you have a 3.8 platform, you choose the 3.5. You do a little platform switch, and everything is correct. But you have only 2 digits inside our website: name of the implant, diameter of the implant, and it show up the exact reference that you have to order for your specific implant. Freelite, Astra, any brand or any brand that you need, you have only to choose to tape, to write, and choose the correct reference.
Okay, so we have different way to use those kind of abutment, but very, very important things is what we have told you before. So that you can use always a straight multi-unit abutment, also in case of divergence. Very important is to choose the correct position of the abutment during the construction of the rehabilitation, because you have to position the extra great portion of the abutment according with the direction of the divergence of the implant. Okay, so in this case, you can see there's a flat portion, the green one. It's the flat portion. In this direction, you have the widened area of the abutment, so the one that is called the extra grade. In this case, the widened area in the frontal implant are positioned in the direction of the divergence, and in the distal implant the same. Okay, so you can choose the axis of insertion according with the direction of the implant. This is how to bond those abutment directly in your rehabilitation, that it can be built in CAD-CAM or Castable or as you prefer. So this is how to use the final abutment, so the extra grade final abutment for this kind of rehabilitation. But there's also the possibility to build a provisional that is called wire reinforced provisional. So it's a very easy way to build a provisional with a reinforced that it's related with the use of dedicated abutment. So in this case, if you want to build maybe an immediate loading reinforced provisional, on that way you can build it very, very easy and in a very fast way. So this is the video of how it works, and Gianni maybe can tell us.
For example, who is doing immediate loading and is used to do it at the end, they prefer all to have this kit, because you have all a series of Equator that you choose about the platforms that you are using, you know, Freelit, Xive, Astra, Nobel, any brand. So you are ready to go, and yeah, you are ready to screw correctly on directly on your implant, on your patient. So you see that we can correct till 80-degree divergence using a straight Equator. We choose normally the doctor choose to stay below the ridge in the anterior, because always is more aesthetic to comes out with the pink. Then they take the impression with the standard technique. This is a video that is just a training to do the step-by-step, analog in position, stone model. So that is nothing at the end new from the technique. But now, in the immediate loading in the lab, we need to create an abutment and a very fast, reinforce using one specific abutment that have two holes. We use a titanium wire that in the lab we connect each other in 10 minutes. We bend, with our tool, drop of composite, and we are ready. You see, we create a frame in a second where we have only to pour the resin, and we are ready to give back to the dentist a provisional on the immediate loading with a reinforce made in a super easy way, ready to go. If there are, you see, high divergence issue, we can even open a little bit to do more extra grade on the distal to help one easy insertion of the abutment, a passive insertion of the abutment. You see that are rotate in the correct way, in the maximum Equator. The pink are the provisional Seeger, and now, before the end, we just have to, we can use a little drop of Vaseline to help the Seeger to click in correctly. Then they click, they break, and they are ready. You see, are rotate in the right direction, open area where we have the maximum undercut. And now the doctor have only to insert in the mouth the denture, the bridge, first the anterior because it was very divergent, and then in this case the screw doesn't give us any problem, so they use 4 screw, click and screw, and the work is done as a fixed bridge, easy, temporary, waiting for the final one.
So we have saw 2 different videos. The first show how to use the final restoration, so the extra grade abutment, and the second show how to use the temporary kind of abutment called wire reinforcement. So 2 different ways to construct a fixed rehabilitation. But we also can go in a different way, so in immediate loading after guided surgery. Why guided surgery? Because in this case, you can have, after your project, you can have, first of all, an help for the surgery, but you can also arrive the day of the surgery with your provisional already done. Okay? One important thing to consider is what Gianni told you, so the height of the abutment. The same abutment used in removable and fixed rehabilitation need different height. So in the removable rehabilitation, we have to stay outside from the gun. So we need a height that is at least 1 millimeter over respect the depth of the gun. But when we go for the fixed rehabilitation, I prefer to stay inside the gun to don't have aesthetic mistake, specifically in the upper jaw. So one advantage of the guided surgery is that during the project, as you can see in the lower part of this slide, is that you can check the thickness of the gum. So in that way, you can choose before the surgery the correct height of your abutment. When you go in with freehand surgery, it's very interesting to have those kits with 42 different height, 42 different equator of different height. On that way, you have all the different kind of abutment that maybe you can need after the surgery.
Of course, there is a special price for this kit, so it's an help for you to have everything on your own in your office ready to go.
Yeah. So why it's interesting to go with guided surgery? As I told you before, because you can manage the correct height of the abutment during the project, and because the day of the surgery, you have your surgical template, you have your correct height equator, you have your provisional, and you also can have those acrylic control key for the correct position of the extra grade abutment. Because as I told you before, if you have tilted implant, it's very important the correct position of the widened area of the extra grade abutment. So, of course, in the guided surgery, you can choose, you have more possibility to put your implant straight. So maybe it's not very important, the position of the widened area of the extra grade. But sometimes also in guided surgery, you can choose to put some tilted implant, maybe to avoid anatomical structure like nerves or sinus. And in this case, it's very important the correct position, the correct orientation of the widened area of the extra grade abutment. So the advantage of the guided surgery are for sure for the patient, the flapless surgery. So no bleeding, no swelling, no pain, and a very fast surgery for the surgeon. So you don't have to suture after the surgery, you don't have to open the flap, and so you don't have to suture, and you can save a lot of time, okay? After that, you can deliver your provisional at the time of the surgery. So after the screwing of the equator, as you can see in the video. One thing that I like very much is to use a micromotor screw device for the screwing of the abutment, because I can control the Newton force of the force of insertion in Newton, and I can go in also in the deep part of the mouth where sometimes it's a little bit difficult to go by hand. And this is one of the principal mistakes of the use of the angulated multi-unit abutment. So one big advantage, big benefit using those kind of abutment is that you can easily screw the equator in all the position of the mouth. Also, if you can put your implant in the second molar position, okay? And this is very difficult to do with multi-unit, okay? So this is a particular case because we project to insert 6 implants, but we had a problem with 1 implant. So luckily, the implant that doesn't work wasn't one distal implant, so we can use our provisional the same. But one interesting thing is that after 2 months after the healing, we went for the positioning of the remaining implant. And what I want to show you with this video is how easy it is to fix the provisional on this abutment. So this is okay. Here we have already inserted the implant, and this is the screwing of the abutment, as I told you before, with a control of the Newton of the insertion. And in this case, we used those ring for the healing of the soft tissue. So in this case, this ring stay in mouth only the time of the shooter, but I just want to show you how you can use it also for a long time during the healing of the tissue. Okay, so this is because at the end of the shooter, we have those kind of space all around our abutment for the positioning of the abutment. And the positioning of the abutment is very, very easy, like this. And now just protect the suture with rubber dam using a little bit of acrylic all around our abutment and inside the hole of our provisional. And in a few seconds, we have the curing of our acrylic, just finishing. And really in 5 minutes, we have the realization of those parts of the provisional. So very, very, very easy to use, okay? Maybe those kind of rehabilitation, so guided surgery with immediate loading is the most complicated things that we can do in a treatment plane. So you need a CAD project, you need a lot of skill maybe to do that. But you can use those kind of attachment really for a lot of different solutions. And this is the last clinical case. Maybe it's a very, very easy case, but maybe for me is the best things that you have to understand about those kind of abutments. This is a case of a patient that came to my office with the teeth in the pocket because, as you can understand, looking to this picture, there's a broken screw inside one old osteo-integrated implant. So now we have 2 problems. First of all, we have to remove the broken fragment of the screw. And the second mistake is we don't know what kind of implant it is. Because the patient lost the specificity of those implants and she lost the touch with the whole clinical, so we can't know what kind of implant they have. But one opportunity that Rain 83 factory gives to the market is to customize the attachment for unknown implant. The only things that you have to do is take something that was screwed on the end of the implant, so in this case an abutment, but it's enough also a cover screw or a healing screw, something that fit perfectly with the implant, in which they can read the screw and the implant part. On that way, they can manage to customize for you the abutment for those unknown implants. In case you are unlucky, so you don't have nothing screwed on the head of the implant, you can take an impression of the implant, precision impression, where they can read the screw and the implant connection, and they can build the same way something that it can be screwed on those unknown implants. Okay? But the first problem I told you is to take out the broken fragment of the screw, and for that there's a device that it's called broken screw extractor kit. Also, those kits work for a different implant brand because it's done by two parts, devices that help you to centrate a screw, drill that work inside this device. And those devices must fit perfectly with the hand of the implant because it must be perfectly straight for the function of the screw. So if you know what kind of implant you are manage, you just have to tell to the factory, I've broken a screw inside those kind of implants. But if you don't have, you can do the same thing that you have done to have the customized abutment. So send something that was screwed on the implant, and they can give you those extractor kit. This is how to work the extractor kit, and this is the broken screw fragment outside from the implant. So this is our implant free from the fragment and ready to be coupled with our abutment. So in this case, this Equator. A mistake in this clinical case is the first choice of the high of the Equator, because I choose 2 millimeter high Equator because the whole abutment was 2 millimeter high, but when I screw it, I understand that I prefer something lower that can stay in the deep of the gap. So after that, I choose the 0.5 high Equator that are screwed now in this master model. For the provisional, we take analogic impression, and we go with CAD design for the realization of an acrylic provisional that is cemented on those abutments. Okay, why we go with a provisional? Okay, in a case of osto-integrated healed implant, maybe you can go directly with the final restoration. But in this case, we have to do a new crown of on the natural tooth. So we have to wait for the healing of the tissue, and we prefer to give as soon as possible a teeth also on the implant. This is the insertion of the Seeger, provisional Seeger. So we call it provisional because it's a little less strong respect to the white one. So it's easy to use when you have to remove the provisional during the realization of the final restoration. In this case, the position of the extra grade is randomized. So we don't need the position because the implants are straight, okay? But remember, if you have tilted implant, remember to check the correct position of the widened area of the extra grade. So this is the provisional in the master model and in the mouth. And after that, we are ready to go with the final restoration. In this case, the final restoration is all in a digital way. So intraoral scan using the dedicated scan abutment for those abutments. So as I told you before, there's a line of instrument dedicated with this for this abutment, a lot of different kind of transfer, and also intraoral and also scan abutment for intraoral scan. After that, we go with the printing of the template with the dedicated analog, as I told you before, and the final realization. So we save the project of the provisional with some little changing, and after that with the subtraction. For subtraction, we have the Zirconia project, the Zirconia realization that is cemented, as I told you before, in those abutment, extra grade abutment, as you can see the flat area of the abutment. And if you remember, this is the portion related with the extra grade. So after that, the construction of the ceramic, try in mouth of the raw ceramic. And when we are happy, we go with the glazour finalization using of the final Seeger, so the white, the strong one, and the deliver in mouth. What I want to show you in this picture is how can you have very low attachment that are in the depth of the gum, and this is very important to have an aesthetical result. So this is an area of the mouth with not very important aesthetical needing, but you can imagine the same things in the frontal bone in the aesthetic area. It's very, very important to have an abutment that you can have in the depth of the gum, and that doesn't show you nothing after the screwing on final rehabilitation. So with the provisional, we have the condition of tissue, so we have new papilla, and I think an interesting aesthetical results also in a zone with not aesthetical needing. So this is the final arrest control, starting from a situation with two important mistakes, so broken screw inside the implant and unknown implant. And after that, in a very, very easy way, the final delivery of a screwed rehabilitation on implant. So this is the only way that I know to build a screw-retained rehabilitation on implant unknown. When you have to manage implant unknown, the only things that you can do is cement rehabilitation if you don't use those kind of abutments. Okay, so that's all for the kind of rehabilitation that we want to show you. And now we are here to answer all the questions.
Just one, I can add just one something. If you go to slides, I don't know if it's working anymore.
It's go. Okay.
No, okay. Yes, for example, what is very important as a message that also Emiliano already told you is that if you like the solution, you may have 2, 3, 4, 5, 6, 7 doctors, if you are a technician, that are using different platforms. You always comes out with the Equator, and you always comes out with one abutment. So you don't need a lot of components. You really are able to simplify a lot the procedure, the prosthetical option, same as for the dentist. You don't need a lot of multi-unit, 1 millimeter, 30 degree, 25, 17, 1, 2, 3, 4, 5 different heights. Here you have, the Equator in 7 height if you need it, and nothing else. And what is very important is that these Equator are available for all the implant brand in the market. So you just have only to communicate to Flores Dental which implant you are using and which diameter and how tall you want the Equator, the cuff of the Equator, 1, 2, 3, 4, 5. There are for sure Thanasis that is helping you a lot on this technical issue. So we really like that you try to see, because we know that it's working very well. Another important thing is that we are here now for the to reply to your answer and to tell you that this webinar will be loaded, so you can see. You can, if you are a technician, you can show this to your dentist, and if you are a dentist, you can show that to your technician. Okay, so thanks again. We are here if there is any question.
Yeah.
You want to say something, Thanasi?
I want to thank you for the presentation, you and Emiliano. It was very nice. I saw this presentation many times, and every time is something new and interesting.
Yeah, you know, the product are always, you know, similar because the basic of the design at the end is one, but is the different use that are, you know, the win-win situation because you use the same abutment, the equator, single equator for a single retention, bar connection, bridge, unknown implant. So you is not only one retention abutment, is one abutment for multiple use. And what is very important is that it's really, really simple and economical. Okay, so and is available for all the implants. So that even how Emiliano told you, the unknown one, because I'm sure that even there is full of tourists, people that are changing the dentist, some all on four where one is failed and the patient don't know which implant is. So what to do if you are not able to get the component? We scan the design and we offer you the Equator where you can even mix to some existing MUA. You can use one Equator, one MUA of Nobel, of Freedent, of Side. So you can mix up because both are fixed. Then you can also save some screw. You can not use some screw if you have aesthetical problem, and that is one another big advantage. So we also offer to everyone to visit our website where there are other webinars where they can go more deep in some certain situation, prosthetical situation. They can invite the doctor to see or the technician because we show most technical part and dental part. Okay. Everything is okay.
Thank you very much, Gianni and Emiliano.
Thank you.
Thank you very much. For any question, even in a remote, you can forward to us. I'm sure that Ari and Thanasis, they know a lot about that. If not, you can share with me or with Emiliano, and we really wish to visit soon your country. Okay?
Of course.
So ευχαριστώ.
Παρακαλώ.
Thank you very much, Thanasis.
We'll say hi to everyone and thanks again to Floros family, as always, okay, that are in our hearts, like so many other friends that we have in Greece. Okay.
Okay.
So take care. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.